University Medical Center of El Paso is honored to be the anchor for Region 15. Through this waiver, we have the opportunity to work together to make significant progress towards the ultimate goal, assuring patients receive high quality and patient-centered care in the most cost-effective ways.
Our regional healthcare partnership in El Paso is RHP 15. It's anchored by University Medical Center of El Paso. As an anchor, we identified strategic partners, we targeted community needs, we proposed projects, and we also determined funding distribution for each project. This is all with the goal of transforming healthcare delivery in West Texas.
The waiver projects are projects that have significantly helped case management in the fact that it provides services to the unfunded patients of El Paso County that they did not previously have before. Rescue Mission and Salvation Army projects have allowed us to put a nurse at each one of those agencies, and that nurse is our first line of defense, so to speak, so that we've been able to reduce emergency room visits from the shelters and also have a place when a patient is homeless and needs a place to go after they get out of the hospital. Discharge Facilitation Care Transitions has been a real good project for us because what it allows us to do is for our unfunded patients to provide follow-up once these patients go out into the community and they've been discharged from the hospital. We follow the the patients with chronic diseases to help them to stay out and not be readmitted back into the hospital. The Chronic Care Project will do is it goes out into the home and teaches a patient for, say, 13 visits about congestive heart failure or diabetes or one of the chronic diseases. Can be kind of a continuation of the care transitions where we feel like the patient needs more than just what they were able to receive from the short visit that they received from care transitions. So this would be like a 13-week program where they actually get intensive training and teaching in behavior change, how to take care of themselves, how to work with in the community with the resources that are available to stay out of the hospital.
Because of the quality of care, because of the triage, the fact that the nurse walks in the hall and calls people by name, lets people come in her office, talks to them, educates them, answers their question. It's the kind of care that some of these people haven't had in 30 or 40 years.
There'll be a resource to them and explain to them what they can do to manage their blood pressure. I get appointments for them. I make sure that they get seen to get treated. And, get the proper medication prescribed to them, and then they come back in and we educate them on the medication. If I wasn't here, I think they would be utilizing the emergency services at the hospitals a lot more than they are, because I think that we catch some of the problems before they become, emergency type visits. Your heart rate and your oxygen level are good?
I didn't have no means of going to a doctor. My only way is going to emergencies. I've probably been back in the streets, honestly. I'm lucky to have her, and I'm not just saying that just to say it, but it's coming from the heart.
We didn't have a nurse really. What would I do? I would have to go to the hospital, who's going to check my blood pressure, and then I don't have nobody to assist me on this, and she's the only one that assists me with my leg to see, how it's doing.
It looks good. There's no redness, no swelling.
We care for the neediest of our society, the homeless. We provide health services for them, teaching, guidance. We provide assistance with medication. We avoid high cost of useless ER visits. An ER visit can run in the thousands of dollars, not to mention the fact that because they're not working, they are homeless, they can't afford to pay it. So we as taxpayers have to pay that amount of money. We can assess the problem, direct them to discount programs at the University Medical Center. At that point, we make doctor appointments, follow up with the client, help them with their prescriptions, and keep them out of the emergency room.
Our University Medical Center of El Paso Medical Interpreter Program serves patients and families when they come to our facility, and we're charged with giving them language interpretation services for anything from consent forms, from surgery instructions. For example, if they require wound care, they need to know what to look for if there's an infection, increased fever. Sometimes the patient cannot do the care him or herself, so the family member's there, and that way we prevent them from possibly getting something at home instead of coming back to the hospital and then having to be readmitted.
And what we basically do is we try to prevent readmissions. We try to prevent from them coming back to the hospital within a 30-day time frame. So we do a continuum of care for a whole 30 days. We follow up with the patients after they've been discharged from the hospital. We have our nurses go out to the home, and what they basically do is provide teaching, education on their disease process and help them obtain resources available to them through our facility. Before this program started, a lot of our patients would come back and would use us basically as a walk-in clinic. We had a large number of readmissions where our patients used our emergency room as a clinic. They didn't know that there were other options out there available to them. They didn't know that they could be empowered to take control of their diabetes, for example, and they could control it at home without having to come here for the ER for any little symptom that was, possibly occurring at that time.
I've been a nurse for 35 years. I have seen why patients, some succeed and some not. And I thought, wow, if you can work on some of these patients that are non-adherent and get them to take care of themselves, and because we ask a lot of our patients. We're asking our patients to weigh themselves, to check their blood sugars, to log their results. I mean, we're asking a lot from them, and a lot of times we expect them to be, to be understanding what we're saying, and a lot of times they just don't understand. And so what this program does, it works with patients and it helps them by setting goals that we know they can do. If we can teach grandma how to cook as a diabetic, then we're not only affecting grandma who's a diabetic, we're affecting the grandkids who are probably obese. We're affecting the children who are already probably diabetics as well. Why do we have to wait till their disease process is so far advanced that now they're in the hospital, they have amputations, they're on chronic dialysis machines? Why can't we get them when they're first diagnosed or when they just got out of the hospital? And so that way we can avoid these issues.
In my career of 35 years in healthcare, the waiver has been transformational to our community and to improving the lives and access to care of many patients, of many citizens in our community. The waiver allows us to be able to improve access to care to many individuals that do not have access to care, and we're improving and changing lives, and that is very significant in our community. We're making profound changes in their lives.
They come to me whenever they don't feel well, so I think I am making a big difference, and that's very rewarding to me.
This program cuts that revolving door in the emergency room.
These are just programs that have been hugely successful and a real boon to case management. These are just services that before patients didn't have the availability of home health. They didn't have the availability of care transitions. So it was just, discharge them back out into the community and wish them good luck.
This program has been a miraculous success.
I currently have 7 nurses working that we go out throughout the El Paso community area, and I tell them, you're going to see the transition of the patient from when they're barely discharged and how much disarray they're in to when they've actually graduated from our program 30 days later, and they're calling us and telling us, you know what, my diabetes is under control, you know, I feel better, I have more energy, I'm able to work now. And that itself is the tearjerker, where you're like, I did something.
We had this other man who had a spinal fracture that they got, and he had not walked in years. And so we got him for other complications of a surgery that he had. And our therapist worked with him because he never had that therapy before after his initial diagnosis. And he was able to walk with his walker. And you could see that smile on his face, and it brings tears to your eyes, because that's what we're here for.